Hello, I'll be taking you into the summary of the 9th HOZ Neurosurgery Mentorship of 2022. So it all started with this poster being published online. Dr. Hoz here with students from previous mentorship telling us that it's going to be 10 sessions online, neuroanatomy, neurosurgery, intra-op, neuroanaradiology, research opportunities, getting to know the Iraqi research into neurosurgery, and many, many much more. So the registration just started with sending a motivational letter to be accepted, and participants were about 250 from 18 different countries. The course did include feedbacks, pre and post surveys, and certifications were given for various reasons, sometimes for the most active participants, and of course for all participants who were unfinished the course entirely. Another very important is the opportunity for research for future scientific publications. All of this large volume of information and opportunities was completely for free. Dr. House took us into many cases, intra-op, aneurysms being one of the most. This is one of the cases, an aneurysm just bleeding heavily, but then Dr. House manages to get by and just clips it close. Patient saved. Very interesting. Another important case is the arteriovenous malformations. This time, this was of the spine. He took us into the anatomy. He took us into the dissection, into the gross examination of the aneurysm, and then how to cure it. What are the principles of treatment for the surgery? In this case, Dr. House just took us into explaining the aneurysm and what's the difference between the saccular and the fusiform. This patient has a fusiform aneurysm of the anterior communicating. Listen to this.
And the anterior cerebral from other side we don't see in this view. However, it goes here, and this is the continuation of anterior cerebral artery.
And just like that, he drew everything for us. This is the same aneurysm being treated.
We are looking more from lateral aspect. Okay? Okay. And by the way, this is the PCOM artery, this is the supraclavian carotid. Now we can see the lateral surface. So this is the posterior communicating artery, and these are the two anterior choroidal arteries.
So yes, the anatomy completely, the pathology completely, the treatment. Another very exciting perspective of the course is the participation of students from previous mentorships. Here we have Jaafar telling us his experience and how precious the opportunity for him was to go on and see some open and endovascular operations in neurosurgery, Tiba with her story and how much it benefited her from engaging in this mentorship from previous years. Hajar and how this mentorship helped to kickstart her skill in sketching neuroanatomy and sketching neuropathologies, and we can see her sketch here of the arteries, and Zahra telling us here of a very interesting case she encountered and how it had a cephalocele. We have Dr. Aktham here telling us of his very interesting experience in the previous mentorship and how it helped shape his path into neurosurgery. Dr. House here just explaining us more and more of anatomy.
The infundibulum, this is the pituitary gland, and the flat area after it, we will call it the tuber cinereum. And after that, there should be an elevation called the mammillary body.
And just like that, the anterior commissure, the posterior commissure, all around this area. And we had, of course, large talks about neuropathologies. We have what is the cause of this very large air inside the skull, what is the cause of this bleeding, this IVH, this intraventricular, this epidural, this extradural. It takes us all through the etiology, all through the pathogenesis, all through the treatment. And he helped us think in a very neurosurgical way. For example, he helped us imagine and expect the etiology of this traction hemorrhage. And he also helped us to get the best benefit out of gastric coma scale, and especially of the motor part. He took us into neuro oncology and many meningiomas. He told us what are the pitfalls in this particular surgery, and he drew for us, he explained for us, he gave us the imagination of the same neurosurgeon. And feedbacks were most apparent, especially when Dr. House were sharing with us one by one when every article was being accepted for publishing. Here he has many articles sending to us, and of course, the students showing major appreciation time after time, study after study, until the students themselves getting so excited about it that they started asking Dr. House for opportunities in research. And look at this, so beautiful. One after one, asking for the same opportunity, one after one, many students. This is the best way of learning. Dr. House gave us the precious chance to meet and listen to major and many neurosurgeons around Iraq, from Kurdistan to Baghdad, neurosurgeons who are pioneers in their work, like Dr. Hadi Khalili, Dr. Ali, Dr. Ahmed Haider, and many others. For example, some explained to us the gamma knife experience in Baghdad and Iraq. Dr. Ahmed here explained to us his approach into the thalamic surgery. And look at this, all students being comprehensive, attentive, asking, receiving, communicating with each other. Dr. Hadi Khalili here told us how important research was throughout the years, how it changed medicine.
The miracle drug it was called. It was used to treat morning sickness during pregnancy. And everybody really was happy with that. And then they discovered that it produces massive congenital anomalies.
Just like that, case after case. Of course, we had the major opportunity of meeting worldwide neurosurgeons like Dr. Osman here, Dr. George Elizarov here, very exciting. Dr. Osman himself gave us a speech about the future of medicine and future of surgery. Listen to this, very exciting.
So that's, if you can't see it, if you can't see anything, it doesn't mean it doesn't exist. And this is a picture just taken 3 weeks ago from.
And just concluding that we, as the young generation, are the future of Iraq. Dr. House concluded with a quiz to test out our knowledge, a very large appreciation from all the students upon the finishing of the course. Dr. House was a large mentor. He gave us one of the best mentorships ever. Thank you for listening to me. I'm Jaafar.